here in my personal life, I'm saying, wow, you make nutrition changes and you feel better, but everything you read about IBS, you know, it's not about, doctors and researchers, even to this day, really minimize the impact of food, which makes no sense to me. It affects the intestines. The intestines' main job is to process food. How could food not have an impact? So then, luckily, out of a far-flung corner of the world, Australia, researchers came up with this new diet called the Low-FODMAP diet. And it really was the brainchild of a dietitian in Australia who saw that her clients, her IBS clients, all kind of reacted to the same foods. So she hooked up with some researchers at Monash University in Australia, and they said, let's look at what these foods have in common. Why are they causing problems for people with IBS? And so what they found out was that there was a certain group of carbohydrates that when people with IBS consume foods that are high in these carbohydrates, their symptoms were worsened. So they found that when people restricted high FODMAP foods from their diets, 75% of IBS patients experienced significant symptom improvement. Now this is unheard of because again, usually you're just told, you know, take this, you manage your symptoms, but the fact that, you know, people, and I've seen it myself and my clients, they go on this diet and for the first time in, you know, years or in their life, they feel like they have a normal stomach, a normal system. And so they can do things like meet friends for breakfast, go for a hike before lunch, things that they had never been able to commit to because they could not count on their bodies. So the diet is not intended to be a long-term diet because FODMAPs are actually, some FODMAPs are healthy foods. Everyone is reactive to every type of FODMAP. And the point is you want to learn which foods you can and cannot tolerate so you can really broaden the foods that you can eat. So just to give you an example of a couple of FODMAPs you have actually heard of, lactose is one, so you know people have lactose intolerance. Fructose is another, some people have fructose malabsorption. So those are the more common ones that you might have heard of. Now, of course, high fructose corn syrup is in everything. So you could see how this diet would be tricky for people.